Over the years, MS Teamworks has shared different perspectives on MS from patients, care partners, family members, and healthcare professionals. Guided by our mantra, I have MS, I have a team, I have a future, we are proud to share new messages of hope and inspiration with the MS community.
I have MS.
I'm on your team.
I have a future.
I'm Kathy Costello. I'm the Associate Vice President for Healthcare Access at the National MS Society. I'm also a nurse practitioner with over 30 years of experience in MS care. Self-advocacy is an often used term, particularly in healthcare. It can actually encompass a lot of things. So no one knows someone's multiple sclerosis better than the person living with their multiple sclerosis. And more importantly, no one knows what your goals are, your needs, your aspirations better than you as an individual. So you have entered your life, your adult life, with goals, with needs, with a value system. And now you have to incorporate MS into that. And you have to let people know so that you can be your best self-advocate, meaning, is your healthcare team addressing your goals and your values? Is the medication that you're on affordable to you? Are you able to have the information that you need to have a conversation about treatment options? And not just disease-modifying therapies, but what about symptom management? What about your potential need to know what kind of diet should I be on? I want to talk about that. And feeling that you're equipped with the right information to have those conversations. So to me, being a self-advocate is knowing yourself and being able to discuss what's important to you and being able to have what's important to you incorporated into your life, and now your life with MS. There are various aspects of someone's life where self-advocacy becomes critically important. Certainly one that comes to mind right off the bat is the therapy that someone's on. So one has to have knowledge of what those therapies are and have a discussion around the use of the medication, the efficacy of that medication or how well it was found to work, and also the side effects and the risks. And then have a conversation on which of these medications, there's 17 of them now, so which of these medications fits best with that person's lifestyle, with what they're doing in their life, and also with their MS. What might be best to control the relapses and the progression and the new activity in the central nervous system for that particular individual. And so that's a bit of self-advocacy and being able to state, this is what's important to me. Along with that is the affordability of these medications and being able to advocate on your own behalf with your insurance company. Oftentimes, the medication that might be best and what you and your medical provider feel is best isn't what the insurance company feels is best, and it may not be the top choice for them. So how do you speak to that insurance company to be able to get what you need? How do you talk with your healthcare provider office so they can help with that process if, for instance, an appeal is needed? So disease-modifying therapy is a huge area of self-advocacy. You may find that you need to self-advocate in your workplace. If you have disclosed your diagnosis, which many people do, and it's perfectly fine to do, but if it's perceived that you're having issues, you may have to advocate on your own behalf as to what you're able to do. Or if you're having issues at work, but you're still able to do the job, you may need modifications, and you may need to have a voice in order to get the modifications needed so that you can still be productive and do the very same job that you were doing before your MS. So those are two really common areas of advocacy. It could also be around symptom management, for instance, advocating to have rehabilitation. Having a conversation with your healthcare provider to say, I'm having issues with this, can we talk about rehabilitation? Advocating on behalf of yourself in terms of other types of treatments or services. And what you need in order to be a self-advocate is information and knowledge. It's really hard to go out and speak for yourself if you don't have enough information. You need to be a credible source of that information so that you can have an informed conversation and really fight for what you need. I think it's really important for people to be knowledgeable and to understand the disease, to understand the various treatments, and not just disease-modifying therapies, but what about lifestyle? What about activity, exercise, diet? What of those things are important, and what should I, as a person living with MS, what do I need to know? Because without that information, you can't advocate on your own behalf. So this is truly the adage, knowledge is power. It truly is. So learning as much as you can about MS and the treatments is really paramount. And so then the question becomes, well, where do you get that information? So it's not Dr. Google. I will assure you that is not the place to go. But it is important to go to credible sources. The National MS Society is a credible source. Often universities that have MS centers. So I often will say to people living with MS, if the web address ends in .org or .edu, you're probably in pretty good shape. When it ends in .com, it could be good. It could be a great site, but there's more question associated with that. So I think it's important to get credible, well-sourced information and then use that information on your own behalf. I was a healthcare provider as a nurse practitioner for a number of years, and I recall one individual coming to me and was diagnosed with MS. She was a very successful professional and didn't know a lot about MS, and why would she, unless she knew someone personally, had a family member. It's just not information that you come by naturally. But she actually did her homework, and so when she came back after the diagnosis was made, we had another visit where she came back and we talked about treatment. And she came in very powerfully and sat down and said, I want to be on drug X. And I said, okay. I said, well, tell me about that. Tell me why. And so she talked about what she does for a living. She talked about her lifestyle. She talked about the drug, what she knew of the side effects, the administration of the drug, why she felt that that was the best drug for her. And I thought that that was remarkably empowered and remarkably informed to be able to have this is the reasons, 1, 2, 3, 4, 5. So then we talked about other medications. We talked about not the gamut of all 17 medications for MS, but we talked about a variety of approaches to care. And at the end of that, this still fit her lifestyle best. So she had really advocated on her own behalf to have that conversation and to make an informed choice on which medication she was hoping to be on. And I thought it was remarkable on her part. To my knowledge, she is still on that medication now, and that's been quite a few years. But I think the more people feel that they can say, listen, that's not going to work for me. Is there something else? Now, maybe there's not something else that you can do, right? Listen, this is the path we need to go on based on all we know about your MS. And let's see how we can best fit that into your life. It may not be our first choice. And I think the other thing is that even though the person that I discussed came in and had a firm idea of what she wanted, what if that drug didn't work? What if her MS broke through? We have to rethink that. All right, and then we have to revisit the whole scenario again. You know, what are your goals, the values? Let's see if this medication addresses the needs of your MS, because we really do need to address that, and we can also help incorporate that into your life. So I think there has to be a measure of flexibility. As much as we want to be strong advocates, there's a lot of barriers to being a self-advocate, and we have to be cognizant of that, figure out workarounds, or figure out the compromises that hopefully aren't severe, but may need to be made in order for people to really have the best life. And that means the best medication at the right time for someone, or the best care, the best services, and so on. What I'd like you to remember is to become knowledgeable. Knowledge truly is power. You need to use that knowledge to have conversations to protect yourself and to ensure that your needs, your values, your goals are understood, that they're respected, and that they're valued, and they're incorporated into your treatment plan. You also need to be knowledgeable of the system that we live in terms of healthcare. It doesn't fall like manna from the sky. You need to become informed and dig in and understand what you need in order to get the things that are necessary for you to live the best life you can with multiple sclerosis.